Hi everyone, Aaron Brooks with Perfect Postures. Today I'm going to talk about low back pain. As if you've watched many of the videos, we're always talking about low back pain, how the pelvis affects that. Well, there's always one thing that's like a recurring theme that we find that oftentimes isn't seen or even looked for with other healthcare practitioners. So I want to show you one key finding that we see. But before I do that, many times people will come in, they'll have pain, whether it's low back pain or SI joint pain, or maybe there's some sciatica or some radiating pain down through the leg and into the shin and foot. The key thing is when people get an MRI, maybe it shows L5S1 or L4, L5 bulging disc, or maybe some stenosis in that area, or maybe even shows some inflammation in the SI joint. Well, the key is you have a diagnosis, and that's important. But here at Perfect Postures, we're always trying to find, what's the root cause? Why does someone even have this in the first place? A diagnosis, again, is a diagnosis. It's just telling, okay, what the problem is. It's not saying what caused that in the first place. So the one recurring theme I'm getting back to is there's a rotation in the pelvis. And what I mean by that, I'll just show you on myself here. We'll say that if you take these 2 points on your pelvis, and if this right side was forward this way, there's going to be a rotation, and that's in the transverse plane. So there's a twist this way. Now, what's important about that is as this pelvis twists, if all the tension up and down your spine remained constant, that everything would just kind of go with that, right? Well, we don't function that way. So there's going to be some type of compensation the other way. Maybe the torso counter-rotates it. Or maybe the person will actually position their foot differently because they're trying to take that tension away from the low back. So again, if you're either working with clients or patients that have low back pain, or if you are just a chronic pain sufferer yourself with low back pain, this may be a key finding that you're not looking for, or may just kind of missing. So again, what you want to do is you want to look at the 2 points in the pelvis here and just see if one's forward the other. And what you could also do is just look at someone from the side view. If I'm standing here like this and I twist this way and you see that right gluteal muscle, but then you have the person turn around, you look this way, and you can't see that, well, more than likely that means that there's going to be a rotation. In some cases, there's some other deviations, but overall, it's probably that rotation. So I just wanted to share that with you because we see this so much here at Perfect Postures, and that's one of the key things that we're always going after. So you could use that as a little test on our Facebook or YouTube. If you have questions, please don't hesitate. We're always trying to provide you with as much information as we can. So stay tuned for next week, and we'll see you then. Thanks.